Hi, I'm Danielle Matus at Caring Medical Florida, answering a popular question on whether or not someone would be a candidate for prolotherapy regarding their hip. A lot of people are suffering from hip pain and reach out to us wondering if they would be a candidate for prolotherapy, PRP, or stem cells, and I'm hoping to answer a lot of common questions in this video. We titled this video Hip Osteoarthritis, Silent Then Screaming, and this might make sense to a lot of you. A lot of people have no hip pain, or maybe they have a little bit of hip pain that kind of comes and goes, but overall they're functioning fine until all of a sudden they sprain their hip, they quote unquote pull a hip flexor, pull their groin, and then all of a sudden they're being told they have bone-on-bone arthritis and need a hip replacement. We hear this a lot, and the reason why is because your hip oftentimes just kind of slowly degrades over time until people do end up with end-stage osteoarthritis, at which point they may reach out to us. So I want to go over today some good examples of good candidates, poor candidates, and how we can help you review your case. How we determine if somebody is a good hip candidate for prolotherapy, or if we do think that person needs a hip replacement, involves reviewing of several things. One is recent x-rays, which we'll actually go over some examples here. Physical exams, specifically looking at the injured hip's range of motion, and then the person's ability to walk. These are x-ray examples of what we would call a good candidate for prolotherapy. And again, prolotherapy really is just this umbrella term that does also include PRP, or platelet-rich plasma, or stem cells. But if we look here, like this x-ray, just to orient you, the hip is what we call a ball and socket joint. This right here is the ball of the femur, and then right here is the socket, or the acetabulum. You can see here like the nice round edges of the bone. You can see there's space between the ball and socket. These are good things. Over here is another example of what we would call a good candidate, where again you've got nice crisp round lines on the bone on both the ball and socket. This patient does have a little bit of arthritis with a little bit of a spur, but overall they've got good joint space, and if they've got good range of motion and they can walk well, that would make them a good candidate for prolotherapy. Now, a poor candidate, somebody that really probably needs to see orthopedics about total hip replacement, would be somebody like this. Like this is their good side. So looking at their good side, you can see the good space, again, the nice crisp bone definition. And look, I mean, it's very, very different on this side. You can almost see like this bone has started to collapse. Instead of this nice round ball, it's kind of collapsed. There's less space between the ball and socket. These bone spurs growing. Like this is somebody that would likely need a hip replacement and would not be a good candidate for prolotherapy. Again, the hip being that ball and socket, you want to see a round ball on x-ray. When the ball is flattened and kind of become more oval-like, that means that the degeneration has been going on so long that the bone has actually changed shape. And the nature of prolotherapy is regenerating soft tissue. We're not going to be able to change the shape of a bone, so that would make somebody a candidate for a total hip replacement. You can see here too, there's loss of joint space, a big bone spur. So really people that have severe osteoarthritis and degeneration, no cartilage or no joint space left, development of bone spurs, severely limited range of motion on physical exam, like they can't move their hip outward or inward, what we would call internal or external rotation. Like if somebody can't kind of point their knee inward, that would be a sign of loss of range of motion, or unable to flex the hip to 90 degrees. Like if you were going to bring your hip to your chest, if you can't get that to 90 degrees, that would make you less likely to be a good candidate for prolotherapy. This is actually a graphic that we made up to kind of show like the difference in range of motion between your good and bad hip. And this is a good point, is that a lot of people may have severe osteoarthritis on one hip but not the other. And so if someone has like a good hip and a bad hip, we like to compare the two. If somebody has like good and their bad hip have the same amount of range of motion, which is good, then they're more likely to do well with prolotherapy. If they have full range of motion in their good hip, but their bad hip, has no range of motion, then they're much less likely to do well with prolotherapy, and a hip replacement would be necessary. So somebody at home that might be wondering if they're a good candidate or a bad, you comparing your good hip to your bad hip in terms of range of motion can be very helpful. If you're somebody at home that's struggling with hip pain that may have already been told you need a hip replacement and you're looking for a second opinion, or if you just have hip pain and want to explore non-surgical options, please reach out to us. We're more than happy to review your case. What would be involved is right here is a brief history that tells us what you're currently able to do physically, what you would like to be able to do physically that you can't do, meaning like your functional goals, medical conditions. Recent x-ray images like we showed you in this video are helpful so we can see what your joint space looks like, what your bony anatomy looks like, any other imaging reports, and then a small video of you walking, to and from the camera so we can see what your gait looks like, as well as range of motion videos. And then we can use all that information to help us determine if you would be a good candidate. One of the determining factors in what would make someone an excellent, good, or poor candidate for prolotherapy to the hip is range of motion. So I'm going to show you what would be like an excellent candidate for prolotherapy. So someone that would be an excellent candidate has full range of motion, like full flexion. This is external rotation. They can point their knee outward. They can internally rotate their knee fully, like point their knee inward across their body. This is great full range of motion. This would be someone that would likely really excel with prolotherapy treatments to heal their injuries. And what we always want to do is compare, motion to the other side. So again, if they've got excellent motion on both sides, this would be a really good prognosis for prolotherapy. Somebody that would be maybe like a very good candidate for prolotherapy would be someone where, they can still, flex their hip up maybe like 100, 110 degrees, and they can rotate their hip out, or externally rotate, we should call it, but maybe they can only internally rotate slightly more than neutral. So like this would be neutral straight up, and they can just internally rotate it a little bit. This would be someone that would be like a very good candidate for prolotherapy. Someone that would be a good candidate, so not excellent, not poor, but just kind of right in the middle, would be someone that could maybe bend their knee up to like 90 degrees. Let's say they can't really go farther, but they can make that 90-degree mark with a little bit of rotation in either direction. Somebody that we would call a poor candidate for prolotherapy would be someone that, likely they've been told that they need a hip replacement. And we look at their range of motion and always, again, compared to the other side. And maybe, they can maybe kind of almost get to 90, but they cannot rotate at all. Like their hip is just stuck here. They cannot get their knee to point inward at all. Maybe they have a little bit of external rotation, but very limited internally. This could also be someone that when you flex their knee up, their hip just automatically goes right into external rotation because it can't move at all internally. That would be someone that's a poor candidate for prolotherapy and really should likely go on to get a total hip replacement. If you're a potential patient sending in a video on your hip range of motion for us to review, this is what we want to see. Now, if you have somebody with you, they could, film, or they could help move your leg, or if you're by yourself, we'll show you what to do with that as well. But what we want to see is hip flexion. We want to see how far you can kind of bring your knee to your chest. This is called hip flexion. And then we would like to see external rotation, which is your knee falling out as if you were going to sit cross-legged. And then also hip internal rotation, where you're turning your knee in across your body. Okay? So again, we want to see flexion, external rotation, and internal rotation. And what's equally as important as seeing the side that hurts is we also want to see your good side as well for comparison. Now, if you're by yourself, another way that we could look to film is if we had you try to sit cross-legged. If we could. So if you could show us how you could sit this way, or even with your knees turned in, which might be a little bit more challenging. These would be good views that would help us review your case in the best way possible. If you're by yourself and have a camera set up past your feet, we can evaluate your external rotation by having you lay like this and point your toes outward. Yep, just like that. Or even point your toes inward to look at your external rotation. Again, always as compared to the non-painful side. And then we could simply have you flex your knee up, bring your knee towards your chest on your own, and then also on the other side as well.